Hi, my name is Erica Walda, and I'm going to be doing submission for week two's question. What action do you think you could take to better your rights as a consumer of healthcare? Well, today I'm going to discuss our insurance policies, copays, patient responsibility that goes along with that, whether you're going to be in or out of network, your primary care physician versus going to the med center or going to the emergency room, estimates. Medical records is a huge one, so I will definitely go through and I will discuss all of those options today. So with your insurance policies, I think it's very beneficial to understand the policy that you have, whether that's commercial insurance through an employer, whether it's Medicaid, Medicare, some type of an assistance program. It's very important to understand the ins and outs that are going to come along with that policy. Typically, we're going to have our copays, we're going to have our deductibles if you have a commercial plan, like most of us typically do. The patient responsibility portion of it, it's really important as a consumer that you know what you're going to owe, typically, or an estimate, if you will, about what you're going to pay. So, when you do need to seek medical assistance, whether it's you have a cold or you think you have COVID or, maybe you have a child or maybe they get injured, just really knowing where you need to go. 99% of the time, we can wait until the next day and go to our primary care physician. But sometimes those med checks, urgent cares, doc in the boxes, whatever you typically call them, lots of times those are going to be more expensive. You're going to have a higher copay, and your patient responsibility is going to be higher. That's something that your insurance plans can let you know. As a consumer with an insurance policy, you have the right to know all of that information. So it's very important to make sure that you're going through that. The emergency room should be for emergencies only. I think that kind of goes with that. However, lots of people don't really know what their benefits are and think that the emergency room may be their best option. However, call your insurance. Let them tell you what's going to be the best option for your plan specifically. Anytime you have something done, always, always, always ask for an estimate. Those estimates are going to tell you typically what your patient responsibility could be based off the running of your insurance policy through their system, but it's also going to give you a list of the CPT codes that may be used during those procedures, office visits, anything of that nature. And what you can do is take that estimate, call your insurance. So, for example, I have Blue Cross Blue Shield. Anytime I have to go office visit, things of that nature, I always call and grab an estimate because it's not going to hurt anything to do so. Take those CPT codes on those estimates, and you will want to call your insurance. Ask them to verify that those are covered. Make sure you ask if your PCP, your primary care physician, is in network. Those are very important questions. As a consumer in healthcare, you want to make sure that you get the best bang for your buck, if you will. At the end of the day, I genuinely think that contacting your insurance providers, making sure you know all ins, all outs, whether the physicians that you see, the specialists you see, they're going to be considered in network and assist you with paying less patient responsibility than what you think. With the pricing of how everything in the healthcare industry is, everything is so much more expensive. So at the end of the day, if you can save and get a $15 copay versus a $136 visit at an office visit, I would definitely make sure that you know that information, take advantage of it, and save some money as a consumer in healthcare. Thank you.